here's where I'm going with that. For a union that you have worked closely with since you came into office, for them to come out and pass such a remark, how did you feel about it?
Well, I had a lot of feedback, but I feel that is not the important thing. I shouldn't consciously ignore.
Should they apologize to you?
I don't really care whether it's up to him, whether they will apologize. That is not my aim. That's not my target. You see, the distinction, this is about communication and the perception. The work we do is all about perception, okay? And sometimes I reflect back. There are issues I should have spoken to. I let it slip. Maybe immediate advice, I let it slip. But they slip and die with a certain perception. They die all right, but they die with a certain... And that is why, in this case, I address the press to state the issues, to state the facts. And I think I'm right, because after the press conference, I had a lot of feedback. Okay? And so, somebody is positioning you as a leader, inciting people against you. Okay? Making it look as though even the incident that happened, you even caused it. That is how it's going to be put out there in the public domain. Not for people to recognize the effort you are putting in. And you keep quiet, you sit back. No. But he's not my target. The leaders are not my target. My target is the ordinary Ghanaian, the 33 million people, the over 100,000 nurses. As for the leaders and whoever said that, their motivation is up to them. And that is not the first time he's doing this. You work with TV3, and you know some of the comments they've made in the past and all that. That is not my worry. That is not my marching orders from my president. So that one, let's ignore it. And let's look at what the sector holds for us. So for me, I will continue to work with them, okay? Work with all union members and make sure that we have a health sector that is affordable, that is accessible, that is equitable, and that we can have sustainability and sovereignty.
So by next week, we will know the outcome of the committee's work.
I'm very sure.
Despite your intervention in this matter, we know that the nurse in question has sued RAF, I believe, for some 7 million cedis for the damage done to her. What are your thoughts about that?
That's fair. Let's allow the law to take its own course. I don't need to comment on this matter. Once it's sued and it's in court, I'm a minister. Let's leave that for the courts.
Very well.
And I wish anybody, any Ghanaian, if you don't understand anything, the appropriate forum is to go to court.
How long will you keep the police at the
regional we'll have an arrangement with the police going forward. And you see, so these are some of the things. When issues happen, they shape government policy direction. So now I'm beginning to reflect not only on Ridge Hospital, I'm looking at other health facilities as well. How can we beef up security on every district hospitals? So now we are going to look at how DCs and district health directors will link up with the police, whether superintendents or district commanders in their various jurisdictions. And we have that kind of collaboration to be able to assess them as and when. So these are some of the things you will have to. When issues come, you learn. It guides, it shapes government policy going forward. And so we will have that collaboration, whether to even allow the police to take charge entirely or to increase our own internal security or something. We have missed something.
So, I mean, in your at your first-hand visit to the situation, what did the nurses say was the reason the patient had not been attended to yet?
Okay, to be honest with you, there was some kind of explanation offered because, of course, the minister has come, so they will try to explain those issues. But I don't think that is for the consumption of the public from me, especially so when I've constituted a committee to look into the matter. Of course, they tried to give me, maybe they didn't even know I was going to constitute a committee. So they tried to explain what really happened, especially the medical superintendent. They tried to run me through the incident. But once there's a committee, I don't want to go into that matter.
All right. Then I guess by next week we'll know what the
Yes, I've given them a maximum of 1 week. So I'm very, very sure by the end of the 1 week, the reports will come
Right.
out.
Away from that, let's look at the infrastructure and equipment gaps that bring up some of situations such as this. What is the NDC's infrastructure plan as far as the health sector is concerned?
So at the moment, the status is that we have about 6 teaching hospitals. We have about 10 regional hospitals, and then we have about 9,000 CHIPS, health centers, and district hospitals. That is the status at the moment. So what we are looking at is that how can we increase their accessibility? We are looking at constructing not less than 2 CHIPS compounds in a year in a district, 2. And then there are other health facilities under construction that are ongoing. So His Excellency has directed a percentage in the disbursement of the common fund to also take care of those ongoing projects. And so we have a collaboration between the Ministry of Health and the Ministry of Local Government to supervise, to equip, because after the construction, you must equip the facility, basic equipment. You must also staff it, personnel. So there's that collaboration. We are supervising. Immediately we finish, we have to equip it and then put in personnel to run. And then district hospitals, especially district without hospitals at all, we'll look at them. We will not start 111 hospitals at the same time. We will not do that. I will take them gradually. We are even looking at, I've told you we have 10 regional hospitals, right? Now, it means that we have a deficit of 6 regional hospitals because we have 16 regions. So we are looking at building those 16 regions at least for the next 4 years. So district without district hospitals at all, we'll look at how we can, especially if something of that nature has been started already as part of the Agenda 111, we'll prioritize those areas. And once you're talking about infrastructure, let me bring in the Agenda 111.
We'll talk about that in a bit, and we'll do that when we come back from this break, because I want us to have a lot of time to be able to do that before another break.